The following words come from an interview with one of our nurses from the Misericordia Hospital Surgical Program. This interview was completed by Terilyn Lipka, RN, on June of 2026.
What I wish I had known about documentation. I've been a nurse for a long time, and if you had asked me before this experience whether I was a good nurse, I would have said yes without hesitation. I cared deeply about my patients. I always put patient care first. I stayed late, missed breaks, held hands, comforted families, and did whatever needed to be done. What I didn't realize was that one day my nursing practice would be questioned. I became involved in an investigation related to concerns about patient care and documentation. My charts were audited and the matter was reported to Karna. Looking back, I can honestly tell you that nothing prepares you for that feeling. I remember sitting in meetings feeling scared, embarrassed, and completely unprepared. I kept thinking, if they could just see how hard I worked, if they could just understand how much I cared. But that isn't how the process works. The biggest lesson I learned is that when your practice is reviewed months or years later, your documentation becomes your voice, not your reputation, not how much your coworkers like you, not how compassionate you are, not how many extra hours you stayed, your chart. I always thought my documentation was good enough. Like many nurses from my generation, I would make notes throughout the shift and chart later when things settled down. I prioritized patient care because that was what mattered most to me. Then, during the investigation, I was asked a question that still stays with me today. How come all of your hourly urine outputs were charted at 0200 hours? I explained that I had been in an isolation room with a critically ill patient. I had written the outputs on a paper towel while I was providing care and entered them later. The response was simple. Where's the paper towel? I had thrown it away. What struck me in that moment was that nobody knew whether those numbers came from a paper towel or from memory. What I knew to be true and what I could prove were two very different things. That was a hard lesson. One of my patients during this time was critically ill with dangerously low platelets. I spent hours at the bedside, holding their hand, supporting them, and doing everything I could to keep them calm and avoid further deterioration. The reality is that the computer doesn't know that. The chart doesn't know that. The investigator doesn't know that. You can chart assessments, interventions, and conversations. You can document your clinical judgment, but so much of what makes nursing meaningful, the compassion, the reassurance, the human connection, doesn't always fit neatly into a chart. And yet, the chart is still what will be reviewed. I was surprised by how detailed the review process was. Investigators looked at everything right down to the minute. They examined when care was provided, when it was documented, and whether communication with physicians, charge nurses, and families was recorded. I also learned something difficult about support. Your union can support you. Your professional association can provide guidance. Your colleagues can care about you, but none of them can document your nursing practice after the fact. When questions are asked years later, nobody can go back and recreate what wasn't charted. Only you can do that in the moment. If I could give new nurses one piece of advice, it would be this. Chart as though someone who has never met you will need to understand exactly what happened 3 years from now. Chart clearly. Chart honestly. Chart on time. Document conversations with physicians, families, and charge nurses. Document changes in condition. Document your follow-up. And if you are too busy to chart safely, speak up. Ask for help. Tell your charge nurse. Protecting your patients also means protecting yourself. This experience changed me. It made me feel vulnerable, exposed, and at times very alone. But it also taught me one of the most important lessons of my career. Documentation is not paperwork. Documentation is professional practice. The care you provide matters. Your compassion matters. Your clinical judgment matters. But if your chart is reviewed tomorrow, your documentation is what tells that story. Make sure it tells the whole story.